Hi.
So we are getting a ton of questions, understandably, right now about what's going on during the COVID-19 pandemic. Are we open? Are we seeing patients? ASRM released guidelines on March 17th, and they updated those again just a couple of days ago, saying, really all treatment is suspended until it's safe for us to move forward. However, at Fertility Specialists of Texas, we are seeing new patients, well, virtually seeing. So we're just going to talk to Dr. Chilvers about that and kind of clear up any misconceptions that may be going on out there. So like I mentioned, we're not seeing patients in the office, it's just too risky. And but you're conducting virtual visits. So what does that appointment look like right now?
Well, as you can see, I have my Zoom office here. So I have my virtual office, and I meet with patients. It's been interesting. Sometimes I see people's pets and kids and family members that come into the picture, but it's still been a good way to connect, and I've been able to answer everybody's questions as I usually would be able to. But there's a few things that we have to just plan for in the future and push the pause button on. And, I put it in my assessment and plan because, I have my computer, I have all my notes and take a good thorough history. But similarities are that patients will still get a portal request to fill out, a pretty extensive history. And that's what I use at all my new patients, whether, in person or not. So that's very similar. I'll go through their medical history with them and clarify parts of the history. And then after that, we talk about, their concerns. I talk about what I think is going on, because the history is very good at shedding light on what is needed. And of course, if people have had prior treatments, then we go through that. But I answer questions. I discuss the workup, which will resume once we're able to do diagnostics, which include the HSG, which is a study that looks at the tubes, the semen analysis, which looks at their husband's sperm count and other parameters. And then if there's any other things that need to be done, like known surgery or some other ultrasound things, then we'll talk about that. But the initial visit ultrasound is the thing that, I miss the most doing these telemedicine visits. But of course, I just tell people, okay, we're going to look at your uterus, the shape and contour. We're going to look at the ovaries and count the number of eggs that are in the race to see who's going to be, the mature one for the month. But counting those follicles, it's called the antral follicle count, and it gives us a good understanding of how many eggs people have left for their age. And I think that's a key component of the fertility assessment. So that's put on hold, but we talk about that. So, the good news is, we can still establish the rapport. I can still answer questions that people have. We can still get a game plan in place, either for the diagnostics and the workup or treatment even. So for follow-ups, I'm doing new patient visits. I'm even following up with existing patients to go over their prior lab results that we obtained, and then plan their treatment for when we're back in full force. I have had patients ask me, if there's going to be a waiting list and all of these things, because understandably we're going to be pushing things forward, and then most people are going to want to get started, but we're going to try to accommodate everybody as best we can. And we're taking note of who's, ready to proceed so that we can be proactive, because we don't want people to have to wait any longer, than we have to.
Right.
Everybody's eager to get back to work.
Right, exactly. And that's kind of one thing that I think is so important about these virtual appointments is, we had to cancel so many patients that were ready to start IVF or do their embryo transfer. And right now there's so much uncertainty. And this is one way to kind of focus on your future and focus on something positive, which is fulfilling your dreams of parenthood. And this is just a really great opportunity to kind of take back a little bit of control that's kind of been taken away and say, what, start the process. I'm going to talk to a physician and just get the ball rolling. And I think one thing that's really important is typically, to see one of our specialists, especially you, we're booking several weeks out. And right now, because we did have to cancel so many patients, we're able to, you call and you talk to our new patient coordination team, and then you can actually speak with you like the next day, which is really great, because there's so much waiting involved with the fertility process. You know, so many times people have been trying for years before they even call us. And so then they have to wait several more weeks by the time they call to speak with you. And now I mean, there's one tiny little silver lining, and it's you get to speak with you the next day, which I think is really, really great.
Right.
So
since we aren't doing as many procedures, we do have more time for these consultations. That's true. So, you know, people can get in sooner than they would have been able to otherwise. That's true.
Right. So just my last question, is there anything specific that patients who are booking a virtual appointment with you that they need to do in preparation for the appointment?
Well, fill out the portal. That's very important. That's what we go off of. And if there's any supportive documentation from your OBGYN or another fertility practice, then please get those records sent over to me, and we can go over them together and discuss them and plan based on the past to make a better future.
Awesome. Oh, and one other thing, when people are scheduling, because right now everyone's based at home, so you can talk to anybody from anywhere. You may be sitting on a beach right now. We don't know. Is there
I wish.
right? Is there any consideration about where a person works or lives in relation to the physician that they choose? Because not all of our physicians see patients at all offices.
That's a good point. We do have multiple offices, and you know, I'm in Frisco, and that's where you know, I've seen most of my patients, but we also have offices in South Lake and Dallas. And so on our website, we should have probably some, you know, indicators as to which location the doctors are at. And so you can look at that for a future reference, even though, you know, we can see patients that live, you know, anywhere. It's nice for proximity's sake that people look at that when they're making their decision as to where, you know, they want to go. We do monitoring at all our practices, which is great for convenience, because some patients like live in Dallas but work in Frisco, or vice versa, for instance, and they can, you know, have a visit but then get monitoring somewhere.
So, guys, we're going to wrap up, but really quickly, I encourage you to go to our website, fertilitytexas.com, and look at the physician bios. All of their information is on there. Everyone's really wonderful. And the thing about us is that we do have offices throughout North Texas, but we treat patients from around the world. So I did bring up location just so that, you know, you were kind of aware that not all of our physicians see patients at all locations. But really the most important thing is, as I'm sure Dr. Chilvers would agree, is connecting with that physician and making sure you have a really good relationship and rapport, because, you know, this is the person that's going to help you build that family. So, you know, location aside, it's all about the physician and how you connect with them. So if you have any questions, please feel free to post them below, send us a message through Instagram or Facebook. Send us an email at info@fertilitytexas.com. We'll get those questions over to Dr. Chilvers so she can answer those for you. And thank you so much, and we'll talk to you soon. Thanks, Dr.
Thank you.